Welcome to Health Styles, where we believe that everything you eat, drink, and think directly affects your health. I'm your host, Carol Dean. We know that health is really big business. So our question is, can low-cost alternative medicine be part of the mainstream medicine? Will the politics behind our health allow it? Well, that's our question today and our discussion with Dr. John Finnegan. Dr. Murray Susser has his questioning medicine section with advice on the immune system, and Dr. Deepack Chopara has some tips for us from his new book, Ageless Body, Timeless Mind. That's our show, so let's get started with our health tips section. Now comes the old question, should we eat butter or margarine? Well, Dr. Finnegan's book tells the story of a health food store owner who put a cube of margarine on a plate and left it on a windowsill to invite all the insects to enjoy themselves, and it was there for 2 years. His intent was to prove that this margarine was an acceptable alternative to natural butter. But after 2 years, he saw that not one insect touched it, that it didn't even mold. It just sat there and collected dust. So the shopkeeper stopped carrying any margarine or hydrogenated products, as he considered them to be plastic foods. And now it's time to go to Dr. Murray Susser's office, and we'll be right back with our guest, Dr. John Finnegan. We'll find out why that you may not always be given alternative medicine options at the time of critical illness.
The importance of strengthening the immune system is like the importance of being healthy, the importance of strengthening your life. If you don't have a strong immune system, you don't have the ability to fight off invaders. You don't have the ability to fight off viruses and bacteria and all these monsters that are on us all the time. We talk about the wonders of the discoveries of Louis Pasteur. He discovered pasteurization, but he also developed the germ theory of disease, the idea that there is a specific germ for a specific disease. Who was ignored in history was his contemporary and his rival, Antoine Béchamp. Béchamp was a great scientist who said it's the soil, not the seed. In a sense, Béchamp, even in those days, was saying you have to have a strong immune system. If you don't have a strong immune system, then you're going to be invaded and you're going to have disease. Diet.
Okay, our guest today is Dr. John Finnegan. He's the author of this book, The Facts About Fats and Oils. And the information that we gave you earlier came from his book. So Dr. Finnegan, what we want to talk about today are alternative choices that people really should hear more about. I had lunch recently with Dee Ito, who's the author of Without Estrogen. Now, she was lecturing on a panel with doctors, and her discussion was that doctors should give women, particularly in the case of breast cancer, other options besides surgery, chemotherapy, or radiation. And the doctors were not very pleased with what she had to say. What do you think about this?
Well, the problem with that is that the doctors don't have the knowledge of alternatives to give them. So even if they wanted to give her some alternatives,
what could they say? They don't know.
They haven't studied the field, and the field takes a lot of study. Most medical schools up to recently didn't have a single class in nutrition. This is phenomenal. This is astounding that somebody is a physician and yet knows nothing about nutrition. So
do you think that will change in the future?
That's beginning to change. Now it's like they take one class, but it's like it's so superficial compared to the amount of really knowledge that you need to have to really work with nutrition and herbs in treating illness successfully is enormous. It's taken me a lifetime of study. So I think that really there's several things that they need to do. One, they need to study the field, and the other thing is they need to find associate nutritionists, naturopathic doctors, holistic practitioners to work with, to refer them to, because this is a field that takes a great deal of training, and it's not like I'm not going to go out and perform surgery. You know, if I find somebody who needs surgery, I'll refer them to a surgeon at a hospital. The same thing I would expect that a doctor who wants their patient to get good nutritional advice to refer them to somebody who's trained in the field. So I think this is part of the problem, is that these doctors are not acknowledging the importance of it, and they're not bringing in
An advisor.
Somebody, right, an advisor, somebody who's really trained in this field to help them. Now, some doctors are, and some doctors really want to, and they're trying to find people. Another part of this problem is that there are actually very few people who really do know nutrition thoroughly.
But naturopathic doctors are really trained in herbs, homeopathic, and things like that,
nutrition.
Right? And nutrition. And I am sorry to say, but I think that some of the nutritionists who went to school when, you know, and you eat so much meat and so much oil and so much fat and so much this, that is outdated. There's too much information these days that you don't need your 8 ounces of milk. That is very bad for you. Many people have a lactose intolerance.
Yes, so what I'm talking about nutrition is not like the dietitians' courses and training in schools.
That's outdated.
This is, yeah, it was outdated when it started.
It's okay, agreed. All right. Well, now, let me talk to you about a friend of mine. She has a condition called arterial fibrillation, where her heart is not beating at a proper beat, and they want to put the paddles on and give her an electric shock to bring her back into a regular rhythm.
Right.
Now, they have told her that they've done this. This doctor said he's done it 400 or 500 times. It cost $8,000. So just incidentally, that's $4 million. You know that we're talking about here. But he has given her no other choice. That this is what she really should do. What are alternative choices for something like this?
Well, first of all, let me tell you how I approach disease. I always want to find the cause. Rather than saying, okay, this woman's heartbeat is erratic, let's just shock it. First of all, let's go like, why? What's causing her heartbeat to be erratic? And most of the time what you will find is a mineral imbalance, that the minerals are the main thing that are regulating the proper beat of the heart, the proper electrical.
So if this woman really loved candy or was eating maybe a little too much sugar, that could pull out minerals, I understand, from the body.
Right. Well, her body's probably starving. Most people's bodies are severely deficient in minerals to begin with because of the nutrition. Let me give you an example here that's really critical. I just went to a seminar with a Dr. Silver. This man has spent a lifetime studying heart disease. He was an advisor to the NASA astronauts in working with their heart conditions and their nutrition. He also worked with one of the foremost cardiologists in this country for years, and what he did was when the doctor would remove the person's heart and give them a heart transplant or remove their blood vessels to do a bypass surgery, he would then dissect completely the tissue of that heart, all the tissue of that heart or the tissue of those blood vessels. And you know what he found again and again?
What?
They were severely magnesium deficient.
So magnesium is very important for heart.
He feels, and a lot of doctors feel, that a major cause of heart disease is magnesium deficiency, and this affects the buildup of plaque, this affects the calcium balance, and this also affects the heart's heartbeat. Okay. Magnesium. Now let me give you a couple of other things that are pretty amazing. When people have heart attacks, a lot of times what the doctors will give them is magnesium and potassium because this will stabilize them right away.
I've seen that.
They wouldn't, but to take that one step further, if this is what like stabilizes and balances the heart when you've had a heart attack, maybe that's the cause. Maybe these people have such magnesium to potassium deficiencies to begin with in their bodies that their heart's not able to function properly. Now another thing that he did was they would do blood tests and check people's magnesium and potassium levels, and they would find they were normal. But what he found, and what a lot of scientists have found, is that blood tests can be very inaccurate. So your body has to keep your blood, the minerals and so on in your blood at a certain exact ratio.
And I've read, will it go steal it from someplace?
It will rob, your body will just be robbed blind, you know, from your bones, from your muscles, from your tissues, to keep that blood level at a certain state. And so the blood does not reflect what's happening inside the tissues. Now this doctor, he developed a special test, and he's the only person in the world who did this, where you scrape off actual cells from beneath the tongue, and he measures the actual protoplasm of the cells for the mineral content that's in your body. And you know what he would find?
No.
Again and again, the blood test would say it was a normal magnesium level, a normal potassium, but the cells said they were starving.
How fascinating. All right.
So again, this to your friend who's having an erratic heartbeat, let's look at her mineral levels. Let's look at her nutrition right from the start. I bet most of the time this is what's causing the problem. And it's so simple. A lot of times you just give people adequate nutrition, adequate magnesium and potassium, and their heart condition will stabilize.
Well, all right. Now, the next thing is that they have given her a pill that's magnesium and calcium, but how do we know that that is a good one? And do you think that liquid is better than pills? And where do you buy the good products?
See, the thing is, what he found again and again is that people are they have too much calcium and too little magnesium. So first of all, if you give a pill that's calcium, magnesium, you're continuing to perpetuate that imbalance.
All right.
Secondly, the quality, the type of magnesium is essential. You know, usually what they give is magnesium oxide, which is an irritant to the digestive tract. It will cause ulcers, it will cause diarrhea, and it's poorly utilized. The best magnesium for therapeutic use, like for heart conditions and others, is either magnesium aspartate or magnesium orotate, which is not even available in this country anymore, or magnesium citrate. And these will be like 80% assimilable.
Mm-hmm.
You know,
that your body can assimilate it better.
And utilize it right into the cell. You know, there's a big problem with a lot of these supplements, like iron. The iron pills that are sold in the drugstores and that the doctors give are poisonous. It's not a form of iron that the body can utilize, and this is becoming more and more evident. So the fact that they gave her this magnesium calcium, but it didn't work, so then they say, okay, well, nutrition doesn't work, we have to give electric shock therapy. But the problem is their knowledge of nutrition is so inadequate.
Yes.
This is the problem.
Well, all right, and another thing was that she was given a pill to reduce her blood pressure, but, you know, I've been reading from Dean Ornish and Whitaker that you can reduce blood pressure by diet.
Right. And this, a lot of times what they give people is Lasix or...
Yes, a water pill also.
A diuretic, and it's incredible. I mean, I just had the worst difficulty of my life working with a heart patient who's been on diuretics and medications to lower his cholesterol and so on for like 8 years, and he was practically destroyed. And I had a harder time getting his body to be able to get off, because what happens is these diuretics destroy your body's normal function to process fluids. So then it's like your body's completely addicted to the diuretic, and if you try and stop it, the body shuts down. The kidneys no longer know how to operate without it. So I mean, honest, I've had people with heavy drug addictions that were easier to get them off those drugs than it was getting this person off these medications. But we were successful. It took a lot of work. We used a lot of herbs, a lot of nutrition to help restore his body. But it's, believe me, see, the main thing is that if you look at high blood pressure, you look at heart disease, you look at cancer, let's look at the cause. To me, this is just a very simple thing, you know. What's causing a high blood pressure? Then if you find the cause, let's correct it.
Well, normally, they are attributing it these days to diet, to high sodium content. We're going to have to take a break and go to Dr. Deepak Chopra. We'll be right back, because we do want to know more about how you can support and maintain your own body and keep it in a good shape. This is